Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor. Good morning.
Good morning. How can I assist you today?
I've been noticing some bleeding in my gums, especially when I brush or sometimes when I eat something hard. My gums seem to be red and swollen in certain areas. This has been going on for a couple of months now.
Have you noticed any pain or tenderness in those areas? And how about any bad breath or foul taste?
Yes, there's a bit of tenderness and discomfort. I've also had persistent bad breath despite maintaining oral hygiene.
How often do you brush and floss your teeth?
I brush twice a day, but to be honest, I rarely floss. Maybe once in a couple of weeks or so.
Flossing is crucial in maintaining gum health. How about your diet? Do you consume a lot of sugary foods or drinks?
I do have a sweet tooth. I consume sodas and desserts quite frequently.
Sugary diets can contribute to dental plaque and exacerbate gum problems. Have you had any dental procedures done recently or wear any dental appliances?
No, I haven't been to a dentist in a few years. No procedures or appliances.
All right. Based on your description, it seems you might be suffering from gingivitis, which is an inflammation of the gums. It's essential to address this early to prevent progression to a more severe form of gum disease called periodontitis. Have you noticed any gum recession or loose teeth?
Not that I've noticed, doctor.
That's a good sign. Do you smoke or consume alcohol frequently?
I drink occasionally, but I don't smoke.
Smoking can be a significant risk factor for gum diseases. It's good you don't smoke. Let's talk about treatment. Firstly, I recommend a professional dental cleaning to remove the plaque and tartar buildup. This will be done by a dental hygienist. Following the cleaning, you should notice a reduction in redness, swelling, and bleeding.
And what about the home care? What can I do to prevent this from happening again?
Excellent question. Firstly, brush your teeth twice a day with a soft bristled toothbrush and fluoride toothpaste. Make sure to floss daily, as it removes plaque from areas your toothbrush can't reach. Rinse with an antiseptic mouthwash to help reduce bacteria that cause gingivitis. Lastly, consider reducing your intake of sugary foods and drinks, and visit your dentist for regular checkups and cleanings.
Will do, doctor. Thank you for your guidance.
You're welcome. Remember, early intervention and maintaining good oral hygiene can prevent many dental problems. Take care.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. Can you help me understand why you've come in for this consultation today?
Hi, yes. Over the past couple of weeks, I've been experiencing some discomfort, and after some research, I suspected it might be urethritis. That's why I wanted to see you.
I see. Could you be more specific about the symptoms you've been experiencing?
Sure. I've been feeling a burning sensation when I urinate, and sometimes I notice a slight discharge. It's quite uncomfortable.
I understand, and I'm glad you've come in. It's important to address these symptoms. How often would you say you experience this burning sensation?
Almost every time I go to the bathroom, so several times a day.
Have you noticed any other changes, such as a change in the smell or color of the discharge or urine?
Yes, the discharge sometimes looks a bit cloudy and has an unusual odor.
Noted. Do you have any pain or discomfort in the pelvic region, or have you experienced any spotting between periods?
Not really any pelvic pain, but I did have some unexpected spotting a few days ago, which was unusual for me.
Have you recently changed sexual partners, or have you had unprotected sex in the recent past?
Well, I did have a new partner about a month ago, and we didn't always use protection.
All right. It's essential to understand that urethritis can be caused by various factors, including infections from sexual activity, but we'll need to conduct some tests to determine the cause and the best course of treatment. In the meantime, I would recommend refraining from sexual activity until we get the results back.
I understand. I'm just concerned and want to get to the bottom of this.
Absolutely. Your concerns are valid and will ensure you get the right treatment. Do you know if anyone in your past relationships has ever mentioned having similar symptoms or being diagnosed with an STI?
Not that I'm aware of. I've always been quite cautious, but I guess things can happen.
They can. It's always a good practice to discuss these things with partners and get regular checkups, especially when engaging with new partners. We'll make sure to give you all the information you need moving forward.
Thank you, Doctor. I appreciate your guidance.
Of course, we'll get those tests scheduled and I'll ensure you're taken care of. Remember, urethritis is treatable, and the sooner we address it, the better.